Let's go over lateral epicondylitis and medial epicondylitis. So the areas, it's basically what it is tendonitis. So another term, instead of lateral epicondylitis, it's called tennis elbow, right here. And medial epicondylitis, right here, it's considered golfer's elbow. So with these, it's tendonitis. If they're ever having a flare-up, massage is probably not one of the better things to use with this. Is you want to use more stretching in these areas if they are having a flare-up with anything with the tendonitis problems. And a big muscle that mimics those kind of problems is the tricep muscle. So with the tricep muscle, the best way to go at it is if you have to bring the arm like this, and right here, the elbow region, a little bit superior, we're just going to go 3 different spots that mimic those kind of problems then. So you want to treat that area first before you get into the lateral epicondyle and the medial epicondyle region. So again, triceps is a big one that you want to test out beforehand then. And again, so you don't have to keep flipping back and forth, this is the easy way to bring the arm like this. You can treat the tricep like this then. So for the, right here for the lateral epicondylitis problems, it's mostly the extensors. So it's mostly the extensors of the forearm that could be affected. And then for the medial epicondylitis, it's mostly the flexors that are affected. So most of the flexors, the origin is up in the medial epicondyle right here of the humerus. And the lateral epicondyle of the humerus right here is most extensors. So for this one, again, you can even go a little bit of a snake bite. Kind of warm that area up first. And another option is you can kind of hold like this and just bring it down right on the medial and lateral epicondyle region. So again, if they're really having problems that day, it might not be a good idea to massage that, but stretching might be more beneficial. And with stretching, you can just kind of stabilize the humerus and rotate. So you're going to pronate the forearm like this to stretch it out. Or you can go like this and supinate and stretch out that area too. Or another option, you're just going to compress and push, or compress and pull towards you to help stretch it out too. And you can rotate it one direction or another direction. So you help give a little bit more flexibility to that area then. And with this, just make sure it's in the anatomical position so you know exactly what areas you're hitting then. So again, golfer's elbow, the main reason it's right here is, you know, like a golf swing like this, you put a lot of pressure right on the medial epicondyle. And tennis, when you go like this, it's right here. When you're kind of doing an overhand serve or a side serve, that's where you're putting a lot of pressure right there. So that's the area you want to concentrate on more.